daughter was diagnosed type 1 diabetic in September, and she has been experiencing hyper and hypoglycemia severe. So due to her recent diagnosis, she was sent here for referral.
Baby Ella Wilson, she is a 2-year-old little girl who was referred here from Turks and Caicos. She was recently diagnosed with type 1 diabetes, and she was under the follow-up care of a pediatrician there, and she was having wide fluctuations in her glucose, like with so many highs and lows, and even she had one episode of seizures due to low glucose value.
Well, I was sent to Health City for the sole purpose of seeing a pediatric endocrinologist, because on the island where I reside, which is Providenciales, Turks and Caicos, we do not have any pediatric endocrinologists at any of our facilities. We have pediatricians, but we don't have any specialists in the area of endocrinology. So because of the severity of her situation, it was important that she see a specialist right away.
I changed her insulin regimen according to her needs, and she responded well to that treatment, and her glucose came in target range. And I also recommended an insulin pump with continuous glucose monitoring for her, which would be a better option for her at this age.
First time to Health City, first time to Cayman Islands. I work at a hospital in Turks and Caicos, and our hospital there is fairly new. It was opened in 2009. So when it comes to being in a new facility, posh, nice, clean environment, that I'm accustomed to, and I would say that this hospital has surpassed my expectations. I didn't know what to expect, but I didn't have my hopes up because I've been disappointed too often. But I would say my immediate first impression was, wow, am I really at a hospital? You don't get that hospital feel. You don't get that hospital smell. I mean, you don't get the hospital look. And even with your interaction with staff, you don't feel like you're really receiving medical treatment for detrimental reasons. They just make you feel like everything is going to be okay.
They were really worried, so they came here for better control of the glucose values, and we helped them a lot. Now she's very happy. She is still in touch with me through WhatsApp, and she's very happy that her kids' glucose levels are managed better by her.
In future, Dr. Deepak and I discussed the possibility of her getting the insulin pump installed so that she can have continuous glucose monitoring, and especially for her age, it would prove to be more beneficial to both her and myself as her caretaker, to ensure that her blood glucose levels are better controlled and she doesn't go too low or she doesn't go too high. And she would have a continuous flow of insulin being secreted to help keep those numbers within the normal range. So this is something that I definitely want to see happen for her. Dr. Deepak has already gave me all the information that I need, and Dr. Deepak is able to do all the follow-up with her. So hopefully within the coming year, 2017, early 2017, she can, once my insurance is on board, she can be enrolled for the insulin pump, and we will be coming back on a periodic basis for Dr. Deepak to do the follow-up.
Yeah, the doctors are very responsive, and they send all the records in time, and whatever follow-up we advise, they follow it very correctly, and they do send us the follow-up notes also, so they are also very cooperative with us.
I see people that really have a heart for what they do, and I find that rare. So I would recommend persons to consider Health City as their alternative to other healthcare providers if possible. I would just like to salute them and publicly say thank you, and just publicly acknowledge the fact that they are rare gems in healthcare.